Good morning, everybody. I'll just kick us off for the last talk of this session. So it is my pleasure to be here with you. And if you cannot hear me at the back, please just flag me, let me know. But I'm delighted to have this opportunity to talk to you about a specific aspect of corrosion in relation to the conference theme. But first, I want to thank the conference conveners and allowing me this wonderful opportunity to be here, as well as the opportunity to engage with you in discussions following my presentation. So I'm going to take a little bit of a deep dive into a specific aspect of corrosion related to the concept of conscience and how I think it's necessary to address this corrosion so that we can start resurrecting moral identities for the healthcare professions and professionals as well. So just to give you an overview of my talk today, I want to touch on the current state of morality in the healthcare professions as well as professionals, look at conscience in healthcare, touch on conscience and define it to understand what is it and why is it important. And then I want to address two thinkers that are not necessarily often pulled into the healthcare space to address conscience and the ways that we think about informing and developing our conscience and then using it in practice as healthcare professionals. So I'm going to touch on Edith Stein and John Henry Newman, and then I'm going to show their work converging on a working definition of conscience, or at least methods for ways in which we can think about it that might be more helpful for today's fairly intuitive and somewhat pragmatic world in the healthcare context. And then, of course, as always, I will finish by trying to inject some hope into the situation and to find a positive way for moving forward. So I think it's relevant to touch on the fact that when I speak about healthcare professionals in this conversation today, I'm addressing physicians as well as nurses, but most of this talk will be relevant to any healthcare professional that has practices with a code of ethics or has specific standards of practice. But for the sake of this talk, I'm going to limit some of my explications in relation to moral identity to nurses and physicians specifically. So I'm going to talk briefly about Florence Nightingale, given that we're here in the UK, and she is, for those outside of nursing, she is somebody that we affectionately call the modern mother of nursing. And she said the nursing education has to be of a continuing practical, intellectual, and especially moral nature. Similarly, the World Medical Association in this most recent iteration of the Declaration of Geneva points out that physicians must practice or should practice their profession with conscience and dignity. And actually, this language is still fairly relevant and in place in many codes of ethics for healthcare professionals around the world, including the major healthcare professions in Canada, where I come from. And so I think the positive upshot to this is that it does speak to this language. On paper, speaks to the moral ontology and epistemology of the healthcare professional, or HCP. But it is becoming a bit of a problem in practice because conscience is something that is starting to remain on paper, if you will, for the healthcare professionals. And I would say that to explicate this corrosion of conscience, it's necessary to take a bit of a zoom-out wide view of healthcare today, and I'm going to do that by situating two dominating but conflicting views of healthcare. The first one, which is somewhat receding in popular discourse, and the second one, which is becoming much more forward. So I would say that, of course, I take it that healthcare professionals and professions themselves are moral endeavors, and that across healthcare disciplines, part of this is because we have a proximity to moral issues on a daily basis. They are part of our fabric, the woodwork, what we do, and therefore this needs to be taken, of course, seriously. So I would say that the first worldview, if you will, considers healthcare as a moral endeavor. Sorry, I have to get used to the fact that I'm working with two apparatuses here. Apologies for that. So healthcare is a moral endeavor with conscience being central to healthcare professionals' moral decision-making, and professionals and patients are integrated persons. Care is the language that's used over service. So the word integration is actually something that's very important. I will be coming back to it throughout this talk. The second worldview views healthcare as a service. It's a public affair. It's a much more legalistic approach. Conscience is therefore perceived as private. Healthcare professionals are subject to public or professional authority, and individual conscience is therefore dispensable. In this worldview, the language of patients is such that they're clients, and service is access. However, this is a bit of a challenge because when we talk about conscience, the reality is a freedom that relates to everybody. And one's quick way of explicating this is that there's a human right to freedom of conscience. It's universal, and it's housed in the Declaration of Human Rights and Freedoms, Articles 1 and 18. However, I think it's important for us to be able to situate conscience in healthcare by giving it some formal consideration and definition, and not just and to explicate how conscience is currently being corroded in the context of healthcare. So I speak to the corrosion of conscience specifically because we are at a time where there are meta-level moral disagreements from bench to bedside on the following points. I do note that disagreement is actually part and parcel to bioethics. It's necessary. I also think it is healthy, but it's getting to the point where what constitutes ethical healthcare is becoming very majority focused, and it's evidenced by the increasing legal availability of euthanasia. The role and practice of religion in healthcare, and sometimes its conflation with conscience, and I'm going to speak to that as well throughout this talk, whether or not religion has something substantively to do with conscience, and whether we should take into consideration how religious healthcare professionals relate to their conscience, and if there's a way in which we can refer to non-religious healthcare professionals using their conscience in a way that's intelligible to both groups. And I think that there is it's partially possible, so I will discuss that too today. Importantly, I think there's a lack of attention, or not just me, but rather the evidence shows us that there's a lack of attention being paid to the holistic and palliative care provision related to the global palliative care access gap. The key word here is holistic, and I'll bring that to the fore in the rest of my conversation. This is the most pressing healthcare issue in the world today. There's significant disparity over what constitutes the human person in relation to the self and others, and this is very relevant to moral knowledge acquisition and being able to act on the moral knowledge that we have or do not have. It's predicated on a lack of understanding and use of conscience for moral decision making. So interestingly, although I've declared that there is a corrosion of conscience in healthcare, there is a small body of research that does show that there is some understanding of conscience in healthcare, or at least different viewpoints of conscience in healthcare. And this is helpful to move forward on addressing this gap, this knowledge gap around the lack of conscience in healthcare. So predominantly any research that shows how healthcare professionals use their conscience in a positive way in healthcare concludes for the most part that it's a very positive or influential aspect of their ethical practice. The use of conscience in healthcare by healthcare professionals has decreased stress over issues that trouble their conscience, allows an integrated sense of self in their care practice, allows maintenance of their autonomy and to avoid moral injury. And I'm also going to attend to this notion of autonomy in this chat too. Conversely, the research does indicate that healthcare professionals who are not able to voice their conscientious concerns report a lack of professional support, increased stress of conscience, and burnout, silence, and stigma. So we're seeing, to an extent, attrition, professional attrition, when people are not able to speak and reuse their conscience in practice. So I say that despite this intriguing body of evidence, there's little progress has been made to support healthcare professionals' understanding and use of conscience in healthcare. And conscience, however, receives much more attention in the philosophical and theological literature. So I'm going to turn to that right now, but I will return to this piece around the empirical research and to address ways in which we can move forward on conscience in healthcare. So I'm going to talk a little bit about Thomas Aquinas in relation to defining conscience, and just kind of expand it a little bit to talk about why it is so important and how this seminal work from Aquinas can help us in building a framework or topology of conscience from which I can then extend the discussion today in relation to Stein as well as John Henry Newman. So he does basically assert that conscience is the application of moral judgment to particular cases. It's a certain kind of knowledge in terms of what's needed to inform our conscience. So it's specifically moral knowledge, which is knowledge of things to be done. So Aquinas denotes two levels of conscience, if you will. So the first one is synderesis, or moral intuitions of the good as good. And then also he can levels it up to say that more developed knowledge is necessary to make concrete judgments of conscience, and that is known as the level of conscientia. It can be very hard to apply moral knowledge to particular situations, especially some of the very nuanced and complex healthcare decisions that we make in healthcare. And so the conscience involves action and judgment of conscience that are very specific. And so to have enough moral knowledge to be able to apply this knowledge to specific situations to make something applicable and practical happen in practice, we actually have to have certain kinds. We have to attend very much to our moral formation. And Aquinas talks about the freedom of conscience because it's something that has duties. And he says that we have two duties of conscience. We have to first form it, and then we have to follow it. So I'm going to speak more to this moral formation piece and to talk about moral knowledge development for healthcare professionals. And it's interesting to note that, and helpful to note, and perhaps calming to note that there are many ways in which we can acquire moral knowledge. And in a world today where most healthcare professional students either don't receive much ethics education, or they certainly don't necessarily receive any sort of moral philosophical education, we can also rely on the fact that while we can use our intellect and formal education to inform our conscience, we can also use informal education, discussion, experience, and this is what led me to develop the Aletheia Conscience Project, which is my research project on this topic. So the unveiling of conscience in the experiences of our daily lives. However, first we have to consider, is conscience qua conscience understood and used in healthcare today? And as the research that I've indicated on one of my previous slides suggests, is that no, there isn't a robust definition of conscience, working definition of conscience in healthcare today across the healthcare professions, even though it certainly is there on paper. But how does that transcribe into healthcare professionals' formative and practice experiences? So to talk about moral knowledge acquisition, I'm going to talk now a little bit about Edith Stein and how she has a method for accessing our conscience via our inner world, which I think can be helpful for introducing moral knowledge and the concept of conscience to students in a substantive way. So in brief, Edith Stein was a German Jewish philosopher. She's best known for her work as a realist phenomenologist. However, over the course of her lifetime, she took a turn in her philosophical work, and she adapted elements of personalism, metaphysics, and which culminated also mirrored her personal belief trajectory in which she was first a practicing Jew, an atheist, and then became a Catholic Carmelite nun before she was murdered in Auschwitz. So what is so significant about her work? How can we use it in healthcare to understand what conscience is and to create moral development? Well, across her work, I would say that one of her main contributions to moral knowledge and epistemology developed from her philosophical, theological anthropology of the human person, which generated an integrated sense of self. And she talks about this as the psychological, physical, and spiritual aspects of being human. And this is where the term holistic fits in very well and quite nicely. So for instance, in nursing, it's very common for us to talk about holistic care, and we look at this integrated self, particularly for our patients. But we need to devote more time and space in ensuring that nurses themselves recognize how we are integrated selves, and we had to attend to our psychological, physical, and spiritual aspects of being human in all areas, including moral knowledge acquisition. She actually talks about conscience across much of her work. She discusses it in relation to the state, the mind in her philosophy of psychology, being, which is embodied and infinite, and embodied and finite, as well as infinite being, and the soul, which she refers to as the affective part of the human person. And this is true in terms of nursing ethics epistemology. We'd often talk about or locate our ethics, as I'm sure many other disciplines do, as being part of the affective part of moral knowledge, of knowledge development, specifically in relation to moral knowledge. She talks about her access point to conscience being something that we can, that we have in our interior world. And she talks about moral activity and the work of conscience. This is where it first occurs. Similarly, we can think about how the mind and brain are interior, and over this last century, we've been able to, in healthcare, understand a lot more about these invisible phenomena. So I'd say in some ways we can parallel that and say that, well, similarly, if we can start to understand our soul is also a part of our interior world, and even if we can't see it, we can see the effects of this activity. And she specifically uses phenomenology as method to access the interior world. And I'm going to talk a little bit about her typology of value, in which she looks at how integrating the different aspects of being a human person can help us to arrive at making intentional decisions, which are helpful for explicating how we might similarly make morally intentional decisions with our conscience in relation to being healthcare professionals in healthcare. So she talks about causal events that occur in the intentional mind. There are some kind of thoughts that we have that are not intentional, as she would say, but the ones that are intentional can actually be causal, so they can actually help us to motivate us to act in a way. But the intellectual cognition isn't necessarily enough to fully motivate us to act, particularly not in necessarily moral ways. So she brings in the emotions that we can experience. And she says that emotions are helpful because while they're indicators, not dictators, they can help us register that something meaningful is happening in the interior world. And then she says that our emotions are self-evaluative in a way. So if we think of something intellectually, she said our emotions can help us register whether or not that is something that we should value or reject. They should actually, emotions and thoughts insofar as they can, they should integrate. And this is not saying that she's taking away from the rational or the importance of making intellectual decisions, but she's saying there's other aspects of ourselves that we can lean on to make really fulsome moral decisions. So, and that's, all this activity happens in the soul. And so she said that because this is where the conscience, she said, is located. And phenomena brought forward to the mind may elicit this emotional response that the conscience will motivate one to respond to or reject in terms of value making. And the question we have to ask ourselves, how does the conscience prompt and motivate? To respond to that, it's important to note that over the course of her lifetime, Stein actually started to read Aquinas, Duns Scotus, Augustine, and her work starts to take a bit of quite a turn in that direction. And it's also worthwhile noting that she was given original works by John Henry Newman and asked to translate them into German. So we know that she was becoming influenced by personalism as well before her death. So one of her final pieces of work is called Finite and Eternal Being. And this is where she starts to bring everything together and where her substantive work on conscience is located. So she talks about the fact that we're finite beings located in time, and infinite being out of time is God. She describes a relationship with infinite being of God as interpersonal. And this is how she starts to connect the conscience as being that which in our interior world can be motivated and prompted in a moral way. So she talks about conscience as the voice or call or locution of God to our soul within this inner space, and it's heard through intuition or contemplation. So her method to actually really work out and the interior activity of the conscience, she often says, comes through taking moral intuitions, thinking about them in a more intentional way, but also the way that we experience and what we're feeling across that opportunity. At the same time, figuring out what those responses are mean and then consciously experiencing them are the phases of actualizing these responses in a morally meaningful way, and she does this through the work of contemplation. And in this sense, she shows us what the pre-substantive or intuiting and the substantive or consciously experiencing these response experiences in an intentional way are as the work of conscience. And it's here that the non-religious could also start to work to recognize conscience through Stein's method. So where they might need to have some imagination or the questions they might then ask themselves in relation to the specific religious or theological turn in her work is to question what authority does God and subsequently conscience have in our lives. And I think it's worth noting that it's not to be conflated, the receiving the locution of God to us in our soul and our inner world is not to be conflated with a private morality, but rather understood as response to interpersonal relationship with God. And it's also significant to note that Stein agreed with Aquinas' rendition of conscience, but knowing the moral intuitive world that we live in and using phenomenology as method, she kind of expands the ways in which we can understand and perceive how we can access our conscience. So to return to my final question, what authority does God and subsequently conscience have in our lives? This is where I think the work of John Henry Newman can be really important and vital for addressing not only the worldview that is housed in number 2, in which there's a lot of legalistic ways in which we address conscience in healthcare, which can also produce a bit of a rationalism, which is sometimes the ends to which utility or pragmatic ethics can go. But John Henry Newman specifically speaks to the theonomic authority of conscience, and so I think it would be very helpful for our time to look at his work in this area. So just as a brief overview of John Henry Newman, English philosopher, linguist, poet, controversialist, personalist, epistemologist, particularist, Anglican, the Catholic priest, cardinal, and then saint, now revered in the Catholic Christian tradition. The significance of his body of work presents to us how we can come to holistically assent to the propositions of the Christian faith. He worked in a time of empiricism and rationalism, where faith was reserved for private judgments and revealed knowledge at best, or discounted as non-scientific. There are times in which healthcare professionals' sense of conscience or conscience is sometimes conflated with religion, and sometimes healthcare professionals are dismissed on grounds of their conscience by saying you're just religious. So a concrete example of that would be in Canada a couple years ago in the province of Ontario. Healthcare professionals, specifically physicians, challenged the lower and higher courts of Ontario and the College of Physicians and Surgeons of Ontario because they wanted to be able to ensure that they were not forced to object to obligatory referral, use obligatory referral to refer their patients for euthanasia and abortion. However, the courts dismissed this, and the ruling was that freedom of conscience, which is a fundamental freedom in our Charter of Rights and Freedoms in Canada, was not relevant. They were dismissed because the physicians were simply using their religious, private religious sensibilities to make these healthcare professional decisions. So in many ways, John Henry Newman was actually much ahead of his time. He articulated how to accumulate conscious and subconscious knowledge in a way that makes sense to our intuitive world today, but also counter the rationalist approach of dominant bioethical frameworks in healthcare to some extent now, and also back in his time. He pushes against irrationalism, although he's certainly not anti-intellectual, and he was profoundly personal. So it's interesting to note that Newman's work, especially in the 20th century, which exploded with many different philosophies, has actually been of interest to many different philosophers, including Husserlian phenomenologists, American pragmatists to an extent, and even some elements of postmodern work. So his main body of work that provides an infrastructure for understanding Newman's articulation of conscience is his Grammar of Assent. And it's essential to understand conscience qua conscience and how religious healthcare professionals lean into it, so we can, to a degree, and we'll nuance this further, healthcare professionals can make the case that they have a religious freedom and or freedom of conscience, but these two things are also compatible. So Newman talks about how the fact that cognition should not result only in abstractions, but in knowledge for application to particular situations. So he also agreed with Aquinas, but he was unsettled and uncomfortable with just making notional or intellectual decisions or abstractions. He said that's not really the way that we operate in daily life. We often take for granted certain truths in our lives that allow us to move from formal inference and notional assent, so these intellectual decisions, to real, or what he would say, unconditional assent, which involve our beliefs about something which is enough to motivate us to act. So we had to move us from the realm from just the intellectual, because notional assent does not have the power necessary to motivate. And he accumulates and he concludes much of this work by iterating the illative sense. And in that sense, he talks about how humans have this ability to accumulate subconscious and conscious knowledge over time, which leads us to judge and decide with conviction, enough psychological conviction, to make real and unconditional assent. This can motivate us to act. And I think this is really helpful, especially when we think about a lot of the fantastic research the moral psychologist Jonathan Haidt is doing in the world. And his work has shown us that moral intuitions are kind of the way a lot of people think about morality now, and this is certainly true to a large extent in healthcare. But he also shows us that moral intuitions are universal. So it's important to appreciate how sometimes knowledge over time, especially if we don't have formal bioethics epistemologies that actually consider what conscience is and help us to make conscious decisions, there are other ways that we can rely on supporting our formal or notional assent to finally make real or unconditional assent. But he thinks this is particularly important in the realm of religion, because he talks about, for instance, various phenomena make up our understanding and intuitions: reasoning, imagination, the aesthetics. But the aspect that causes us to feel remorse, blame, or reward is the conscience. And conscience judges an act as right or wrong and affirms accordingly. So this kind of moral intuition is not only rational, it is super rational. It consists of acts that move one from their self-ego and hold them accountable to a higher being or infinite being, thinking of Stein, in relation to conscience. Because Newman says that conscience is actually theonomic. We have a moral obligation to follow God in light of our conscience, because our conscience is rooted ultimately in divine law, similar to what Aquinas, of course, tells us, which makes itself known to us through our conscience, the call of conscience. And it can make itself known to us because God, as infinite being, is a person. Conscience therefore gives us the capacity and responsibility to assent to the moral authority of God in our lives. So there is a religious element to a degree, of course, with conscience. It's not incompatible with different kinds of moral knowledge, but it can lead us to making assent to theology by specifically using your conscience, since it's designed as such. Now, to talk about Stein and Newman, to start winding down my presentation, I will talk about conversions on conscience. So their ideas on conscience actually are not that different. Their method may differ. One thing that is really important, however, to before I say anything else, is to make sure that I reference the fact that conscience, quoting Newman, is not autonomy. So, and it's certainly not this overinflated autonomy-forward ethos that does perpetuate healthcare, which some of my colleagues have already referred to. Rather, autonomy is what Reinhard Kutter talks about is consciousness counterfeit. The reason for this, thinking of Stein and Newman, is because conscience always, as a moral act, prompts us to move outside of ourselves and away from our ego. I think it's also really interesting to note the fact that Henry Newman was ahead of Freud, and he talks about our ability to accumulate conscious and subconscious knowledge. And of course, as we know, autonomy unfortunately does dominate bioethics frameworks in liberal democracies, housing contemporary Western culture and healthcare communities. So it's important to start making those distinctions. And I think Newman does this in a nice way. And not because either one of them view moral knowledge and the work of conscience is purely rational or only emotional, but is also experiential, interior, interpersonal, and necessary to engage with invisible phenomena such as God and faith. And our conscience itself today is disappearing, so we need to find a way to resurrect it for moral identity. So in terms of whether or not this iteration of conscience is relevant for non-religious people, to a large extent, it may not be. But at the same time, Stein and Newman would say, but that is only a matter of perhaps not yet. Perhaps accumulating not only rational, but subconscious and different kinds of moral knowledge will eventually help people on their way to approaching this viewpoint of conscience. However, rather than divorce this viewpoint of conscience because it doesn't speak to everybody, rather I would say that to move forward in addressing the corrosion of conscience in healthcare, it's important to reconsider and to positively uptake the fact that there are religious people in healthcare that can certainly help us to broaden our sense and understanding of conscience. So I think instead of moving and perpetuating this debate on conscientious objection and the polarizing differences that it lends to this larger discourse, it might be more positive to start reframing the discussion, reducing the polarity by talking about different ways in which we can utilize new bioethics frameworks or underutilized approaches to bioethics that can encompass an understanding of conscience needed to support healthcare professionals, both religious and non-religious, so they can start making sense of who they are as morally integrated persons. And doing this by using Stein's holistic approach to integrated an integrated self across our psychological, spiritual, and physical aspects of being human is one such way we can make that happen. I would finally argue that there is a way, an opportunity for science here, for doing theology-engaged science, and looking at ways in which questions of science and theology can work synergistically together. Because it's not true that science and religion cannot work together, that they're irreconcilable. Rather, I would say that the methods of science can help us to investigate the issues of conscience, as well as to create new epistemologies that will enhance the ontology of who the healthcare professional is. I'm going to close by giving one simple example from my Aletheia Conscience project, which I'm working with a wonderful group of healthcare professionals and interdisciplinary researchers. We're right now looking at all of the interdisciplinary international literature to see what has been done by way of any interventions to help healthcare professionals understand and use their conscience. Because rather than saying the healthcare professionals should not be using their conscience, I think it's more important to reframe that discourse and with a sense of hope saying, but we should. It's helpful, it's positive. So then let's use science to do that, to resurrect conscience in healthcare, by providing an integrated approach of what it means to be a moral person. Thank you.